And welcome to Q&A with CNA. I'm Kyle Schwartz, and this month we have a returning guest, Dan Metzgar, who is the, I have to read this, Trauma-Informed Day Treatment Principal for CNA. So since you were on before, refresh us a little bit about your background and what you do in that role.
So my background, I've been with CNA in the day treatment program now, so for 13 years. Been as a teacher there, and now I'm entering my fourth year as the principal. So just kind of oversee the day-to-day operations, make sure we're ensuring a safe learning environment for the students, working with all the districts that we service for our students to make sure they're kept up to date on everything that's happening.
And what was your degree in it?
So my degree, I have an early childhood education degree, okay, and I have my educational leadership degree from the University of Ashland.
Okay, all right. Well, tell us about the day treatment school, because it is it's unique to Stark County. It's a one-of-a-kind. Tell us about that.
So our Trauma-Informed Day Treatment Program, we service kids that have had some kind of traumatic event happen in their life, and it's not just one specific trauma, anything they view as traumatic and they're struggling to kind of work through. So districts will refer them to our program. They'll come get their educational needs met and also get their therapeutic needs met as part of the program, where they'll get 2.5 hours of group therapy every day, individual therapy as needed. We offer family therapy, try and get the kids back on track and get them back in their home school district.
Okay. Well, so a typical day at Shipley is different than what people would experience here at Alliance High School. So tell us about that. How's that structured?
So because we do the 2.5 hours of group therapy, our academic time is reduced to meet the needs of the transportation and the school day time frame. Mm-hmm. So that does make it a little challenging, but it's also beneficial for the students because they're able to come in, get what they need, learn what they need to, and get back on track to get back to their districts. Our school day, typically kids get dropped off between 8 and 8:30, and they start picking up around 2 to 2:30.
Okay, so it's typical time. It's
yes.
Just, there's other things that are going on in between there. All right, so there are 4 classrooms with a maximum of 8 kids. How are they grouped, by age, or like how are they grouped?
So it's all based on grades. So we have a K through 2 classroom, a 2 through 5, a 6, 7, 8 classroom, and then our high school classroom. There is some switchover depending on each student. We look at a lot of individual needs of students throughout the program. That's a lot of what we focus on, just not in placement in the program, placement, what's happening. Yes.
To evaluate.
The way they come in, the way they leave, everything is kind of on an individual basis. There's no set, this is exactly how things are going to work for every student. We try and meet the needs of everyone and every family. All
right. So in addition to the teachers, there are therapists in the classroom too?
Yep. Each classroom has a teacher, a therapist, a behavior interventionist. And then we have our floating behavior interventionists to help out wherever needed. The therapists are in the classroom for their group time. They come in as needed as well because they're pulling kids for the individual therapy, but also just helping out as much as they can. We have a real strong team. Okay.
Well, because of their background, some of these kids obviously will, during the time that they're there, maybe have a traumatic experience or a flashback or something like that. So you have calming spaces?
Yeah, so we have lots of options for kids. Again, all our plans for the kids are individual based. So we'll have students have different needs, and we'll meet those needs. And we also have the calming spaces. So some kids might be calm or going to the gym or going outside. So we have those spaces. We also have, we call them comfort rooms, quiet areas that kids can take breaks or do work. And we also have sensory rooms in the program as well.
Okay. Well, what's the average stay for a student at the school?
You know, everything, like I said, is individualized. So we might have some students that come in and they stay for 6 months. We have other students that may be there for up to 2 years. So general in the 6 months to 2 year range for most students.
How do you keep in touch with their schools and keep them updated? And
we're always constantly communicating with the schools because a lot of students are on IEPs. We send the progress reports. We're up to date on attendance. Keep up to date when state testing comes around. We do review meetings just to keep everyone on the same page. We also like to be in communication with the school about what they're looking for that student to come back. They might have different expectations. Each district has different resources available to them. Some districts might have different rooms, different classrooms that might be more suited for a student coming back. Other districts might not have that, and so they need the student to be in a different place. So everything is looked at, even from a school point of view, individually on what they need and what they expect.
Okay. Well, and as you've mentioned several times, each situation is unique. It's different. But how do you prepare them to go back? And I'm sure some of them are excited to go back, and some of them are more comfortable there, and they don't want to go back. So how do you deal with these?
Again, it's all, we do the meetings, we review, we talk about what everybody needs, what everybody kind of wants and wants to see. So when districts have certain things, we use those certain things in our program as well. Like if they have a place for students to take breaks, then we let them continue to take breaks. But if they're going to a place like, no, this student cannot be taking breaks, so we kind of implement that when we see that they're on that verge of being able to go back. Okay, let's take away these breaks and see what practice your skills of being in the classroom and managing situations, so that they're prepared for that district and what that district expects from them.
Okay. As we talked about earlier, you had the 4 classrooms and they're divided by grades. Is it usually a waiting list in the high school category, or?
It really varies. We'll have some years where we have more high school kids. We'll have other years we have fewer. The past few years, we actually have been getting more of the younger kids. So we've been kind of shifting our classrooms around to leave more open spaces for younger students, because that's what we've seen the influx in the past few years.
All right. Well, since it is a one-of-a-kind program, I'll bet, have you had other facilities come in and like view your program, and from other states or from within Ohio? Or
we've had some other programs, call and talk to us, ask us some questions.
Yeah.
Because no one really does the therapy piece like we do, it's rare to get too many that want a ton to come see, because it's not something they can provide with that. But we do get the occasional, how do you guys handle this situation? How do you guys handle this?
Yeah.
So
I would think, since it is such a great program. All right. Anything else you wanted to add, Dan, today?
No, we just appreciate you guys promoting us like this, and thank you for having me on.
All right. Well, thank you. And thank you for watching Q&A with CNA. I'm Kyle Schwarz.